CCRN Myocardial Infarctions Practice Test Questions, 35 Key Questions. Question 1. Which EKG lead changes would you expect to see in an inferior wall MI? V1, V4, 2, 3, AVF, I, AVL, V5, V6, V1, V2. An inferior wall MI is typically associated with lead changes in 2, 3, and AVF, reflecting the right coronary artery distribution. Question 2. A patient with an anterior MI is most at risk for which complication? Sinus bradycardia, second-degree type I heart block, ventricular septal rupture, third-degree heart block. Anterior MIs often involve the ventricular septum. Rupture is a potential catastrophic complication. Question 3. What is the primary action of nitroglycerin in the management of MI? Increase heart rate, peripheral and coronary vasodilation, decrease blood glucose, inhibition of platelets. Nitroglycerin reduces preload and afterload through vasodilation, improving myocardial oxygen supply/demand. Question 4. Which biomarker is the most specific for myocardial injury? CKMB, myoglobin, troponin I, LDH. Troponin I is highly specific to cardiac muscle and remains elevated for several days. Question 5. A patient presents with ST segment elevation in leads V1 to V4. Which artery is likely occluded? Right coronary artery, left anterior descending, circumflex artery, posterior descending artery. Leads V1 V4 reflect the anterior wall of the heart, supplied by the LAD. Question 6. A new hollow systolic murmur at the apex after an inferior MI suggests what? Aortic stenosis, papillary muscle rupture, pericarditis, aortic dissection. Papillary muscle rupture leads to acute mitral regurgitation, manifesting as a new apical systolic murmur. Question 7. Which medication should be avoided in a right ventricular MI? Aspirin, morphine, nitroglycerin, normal saline. RV MIs are preload dependent. Nitroglycerin reduces preload and can cause severe hypotension. Question 8. What is the goal door-to-balloon time for STEMI patients? 30 minutes, 60 minutes, 90 minutes, 120 minutes. The standard of care for STEMI is reperfusion with PCI within 90 minutes of hospital arrival. Question 9. Fibrinolytic therapy is indicated if PCI is not available within how many minutes? 60 minutes, 90 minutes, 120 minutes, 180 minutes. If PCI cannot be performed within 120 minutes of first medical contact, fibrinolysis should be considered. Question 10. Which EKG finding is a telltale sign of a posterior MI? ST elevation in V1 V3, ST depression in V1 V3 with tall R waves, T wave inversion in 2, 3, AVF, pathologic Q waves in I, AVL. Posterior MI presents as reciprocal changes, ST depression and tall R waves, in the anterior leads V1 V3. Question 11. A patient post-MI has sudden chest pain relieved by sitting forward. This is likely recurrent MI, Dressler's syndrome, pulmonary embolism, aortic aneurysm. Post-MI pericarditis, Dressler's syndrome, is characterized by pleuritic pain improved by leaning forward. Question 12. What is the first-line treatment for sinus bradycardia in the setting of an MI? Atropine, epinephrine, dopamine, amiodarone. Atropine is the initial drug of choice for symptomatic bradycardia. Question 13. Beta blockers are used post-MI primarily to increase cardiac output, decrease myocardial oxygen demand, prevent hyperglycemia, promote vasodilation. Beta blockers decrease heart rate and contractility, thereby reducing oxygen demand. Question 14. Which of the following is a contraindication for fibrinolytic therapy? History of hypertension, age over 65, active internal bleeding, current aspirin use. Active bleeding is an absolute contraindication for fibrinolytics due to hemorrhage risk. Question 15. ACE inhibitors are prescribed post-MI to prevent what process? Hyperkalemia, ventricular remodeling, tachycardia, platelet aggregation. ACE inhibitors reduce ventricular remodeling and improve long-term survival post-MI. Question 16. A patient with cardiogenic shock post-MI will likely have which hemodynamic profile? Low PAWP, high CO, high PAWP, low CO, low CVP, low PAWP, high CO, low SVR. Cardiogenic shock involves pump failure, low CO, and fluid backup, high PAWP. Question 17. What is the significance of a new LBBB in a patient with chest pain? It is always benign. It should be treated as a STEMI equivalent. It indicates a pulmonary embolism. It suggests hyperkalemia. New or presumably new LBBB in the presence of ischemic symptoms is considered a STEMI equivalent. Question 18. Which medication is an antiplatelet often given along with aspirin in ACS? Warfarin, clopidogrel, heparin, apixaban. Dual antiplatelet therapy, DAPT, with aspirin and AP2Y12 inhibitor, like clopidogrel, is standard. Question 19. ST elevation in leads I and AVL indicates in MI in which wall? Inferior, lateral, anterior, septal. Leads I and AVL, high lateral, and V5 V6, low lateral, reflect the lateral wall. Question 20. True or false, morphine is the first-line treatment for all MI patients? True. False. Morphine is used for pain refractory to nitroglycerin but is no longer first-line for every patient due to potential interaction with antiplatelets.